Pain, not death, is the enemy of mankind, and once you learn about Bonnie Prudden Myotherapy, you won't have to be afraid of living with pain. I'm Lori Drummond, certified Bonnie Prudden myotherapist, and I'm going to show you how you can get rid of knee pain. We're going to start with self-help tools. These were designed by Bonnie Prudden myotherapist. This is our crook. It was designed so that the curves and the angles allow you to use leverage so that you don't have to strain to get at trigger points that are not easily accessible. We're going to start in the quadriceps, the large muscles in the front of your thighs. When you're a kid, pain, not death, is the enemy of mankind. And once you learn about Bonnie Prudden myotherapy, you won't have to live with fear of pain. I'm Lori Drummond, certified Bonnie Prudden myotherapist, and I'm going to show you how to get rid of knee pain. We're going to start by using self-help tool. This is a crook. This is one of our tools. This was designed by Bonnie Prudden myotherapist to allow you to use angles and leverage to do the work for you so that you don't have to strain to access trigger points that are a little bit further away than you can reach with your hands. We'll start in the quadriceps, the large muscle group on the front of your thigh. This is one of the muscle groups that is most responsible for knee pain. When you're a child, if somebody grabbed your knee and squeezed and yelled horsebite, made you jump, they were probably hitting trigger points number 33 and 34. We're going to start right about where your middle finger would be. Put your crook down, and we're looking for sensitive points in the muscle. You can use your other hand on top of the crook to stabilize and roll the crook away. You want to be right about where the groove of that muscle is, and it's almost like we're trying to roll up under the fibers of that muscle. When you find a tender point, hold that for about 7 seconds. That's the trigger point. If you don't have one, try changing your angle a little bit just to find those points. Slide about halfway up the leg in that same groove. Roll over onto the point, and under that muscle, kind of scoop up and relax into that. You're holding for about 7 seconds. That's about how long it takes to diffuse that point. Now come on up. That muscle is coming up towards the top of the leg. Put your crook down. You can use your forearm on the crook and just lean into it as you're rolling over. 7 seconds is about what it takes. There's nothing magical about that. If you hold for 9 or 15, it won't make a difference. But if you hold for too long, you don't have enough time to hit as many trigger points. Now, we're going to do the inside of the knee, right about where your thumb would be. So for you to see what I'm doing, I'm going to use my opposite knee, and you always want to balance out your treatments. You always want to do both sides, because if you don't, the trigger points that are left will continue pulling and throw you back into spasm more easily. This muscle starts way on the inside, so we're going to put your crook down, roll over, and hold that. If you need more pressure, you can use your other leg to squeeze with. Now that muscle also, as it's working its way up the leg, it's coming more towards the top of the leg. So towards the center. So put your crook down, roll over, and hold that. These trigger points can also contribute to groin pain, hip pain. They actually can pull on the muscles that go into the low back and contribute to low back pain. So don't forget to do these points for low back pain if you're not getting better, especially if you're a runner that would use these muscles. Crook down, the top one is on the top of the leg, and again, if you feel that groove, it's working its way towards the center of the leg. Roll up onto the point and just relax into that. These, as we're getting closer to the groin, these can also contribute to menstrual cramps. Okay, the next muscle group that is largely responsible for general knee pain are the muscles in the lower leg, the calf. To get at these, I'm going to have you stand, put your knee on the chair, and we're going to go right down the bulk of that muscle. We'll start going right down the center, start below the knee, put your crook down. We're using the small curve now, and just lean back into that. It kind of angles, you're pressing deep and kind of angling towards the knee. And now come a little bit lower. Press deep. As we get lower, you're right in the bulk of that muscle where those two heads are coming together. These trigger points can contribute to cramps in the calf, knee pain, ankle pain, cramps in the bottom of the feet, inflammation of the fascia on the bottom of the feet. Now, come just below that point. We're going to be pretty close together because these are the 2 points, the biggest troublemakers. Same technique. You can lean into it for more pressure. And try one more just above the heel cord. For a more thorough idea of where to place your trigger points, if you have serious problems, you can put them closer together. You'll find these points mapped out in all of Bonnie's books. And now we want to get up this inside edge of that muscle, so sit down again, cross your leg over the other one, come below your knee, feel that big tibia bone? We're going to be on the inside of that. Put your crook down. Now slide that point into the bulk of the muscle. Your hand on the small curve, your handle is pointing away from you, and as you pull it towards you, that is pressing your pressure deep and up against that tibia. So we're kind of wrapping again and trapping the trigger point against the bone. Come a little bit lower. These trigger points are also responsible for shin splints. If you have varicosities in your lower legs and around the ankles, these might be key troublemakers, as well as poor circulation. If you know anybody with diabetes, you want to keep these muscles free of trigger points. They don't need any extra tension on those blood vessels. Their circulation is already compromised. You don't need a compounded problem. Go ahead for one more. And to stretch these key muscles, myotherapy is half of the treatment. The other half is re-educating the muscles and remind them to stop going back to that shortened position where they're more vulnerable to going into spasm. We're going to do knee bends. If you need balance, turn your chair around. If it's a heavier chair, that's a little bit more sturdy. And come on down and back up. These are half knee bends, and you are both stretching the quadriceps over the knee, but you're also working it as you're coming up. So these are going to both stretch and strengthen those muscles, which will help give you a better curve when you're trying to locate your trigger points. For the calf muscles, we're going to stay bent and give it a little bounce. This stretches the heel cord over the heel. Stretches the gastroc, so it's going over the heel, and that gives that a little bit of a stretch. Now for the inside, if you keep your knees bent and roll from one side to the other, that gives you a little bit more on the inside and the outside. These are just a few of your key trigger points. For complete information on Bonnie Prudden Myotherapy, please visit our website at bonnieprudden.com, and don't forget to do your other side. Thank you for watching, and as Bonnie would say, keep fit, be happy.